Hi, this is Dr. Chris Harper. Following on from my last video about how patients can sign their consent forms on the iPad, I thought I'd continue with a few other videos about the apps that I make most regular use of. So today I'm going to continue by talking about an app that I find very useful called the Dental Patient Education app. It is an iPad only app, you can't get it on the phone, but let's go on and show you a little bit about it. So this is the app, and it's designed to help explain problems and treatments to patients. I use it quite exclusively for some things, but I'll be honest, there's a lot of videos in here that I don't use. It can be used in quite a few different ways. Let me just show you a few of the things I use. So there's a few different categories: endo, oral surgery, ortho, perio, prosthetics. I'll pick an animation I use regularly, which is the root canal treatment RCT animation. So I'll let that load. And I find that these give quite good visual explanations of a problem or treatment options. Sometimes I'll skip halfway through a video. I often do that with the RCT one because it explains a little bit about it. You can have an American man or woman explain the problem for you, but generally I just turn the volume off and I do my own explanation. So this is showing an abscess developing, and it's going to show RCT in a very simplified form, but it's a very useful way of explaining to a patient what's going on so they know what's happening. Before using an app like this, I tended to find that even though I thought I was quite good at explaining things, patients still obviously didn't get everything I was talking about. And RCT in particular is a very complex field. So I think this could be quite a useful way of explaining about removing the nerve, getting rid of the bugs down at the tip of the tooth, sealing down inside the canals with the gutta perca, and then when you're happy that it's nicely sealed, as this is showing at this point, so it's showing that in one canal and sealing the other canal, then you put a core filling in the top of the tooth, and then you can go on to explain the fact that the tooth might need a crown or other things like that. So RCT is one area where I use the app an awful lot, but as I said, there's lots of other animations as well. If I show you, for instance, perio, I think it's a very good explanation, or a good demonstration, I should say, of perio. So this is quite a good way of showing the inflammation that develops because of the calculus and the plaque building up around the gums. The gums become red, they bleed, they shrink down away from the teeth, you get the pockets developing. And this is showing that with good home care and with professional help, you can help to get healthier gums with reduced pocket depths. Now I would say this is slightly optimistic in the fact that this now shows full healing. I don't think that's normally possible, but it's a good visual explanation to patients. There's quite a lot of other categories where this can be useful. As I said, a fair bit of ortho, oral surgery, there's some implant stuff on here, some good crown and bridge things, but normally I'd go for my demo model that I've got here. And talking about crowns or bridges, I would tend to jump to my model instead. I think this could be quite a useful tool. So as I said, it's available from the App Store for iPad only. There is a free version of the app that you can download and try that's got just a few animations. If you want the full app, it is a fairly expensive app. I think I paid about £80 a few years ago. Now I get daily use out of it, so I think that's good value for money. I'm not sure exactly what the current cost is, but I think it's useful. So that is the Dental Patient Education app. Please kind of look at all the other information on my website to see other recommendations that I make. And when I post more videos about other apps, I'll put them up here as well. So my website is www.drchrisharper.co.uk. You can also contact me there or via the forums. And I hope you found it useful.